For animals, it's a very small, independent college for animal chiropractic, and they do certification only for vets and chiropractors. So you have to be one or the other. You can't be a layman. So you know, it's a neat setting because the vets and the chiropractors are together. The vets are know pretty much everything about what needs to happen to keep an animal healthy. The chiropractors are there, and we're really good at feeling and understanding the spine, and our ability to touch the body and feel what's really going on helps them, and their medical or veterinarian knowledge helps us kind of round out our practice. So it was really neat to have both sides. And so I did that. I graduated from that in 2008 and started just going out and working on animals. And I'd say initially it was, I'd get a lot of calls saying, you're pretty much my last hope. My dog really doesn't have much chance. They want to, I can't afford the surgery, and we're going to have to put him down, but I wanted to try this. So that's really what I got a lot of at the beginning. And so it was hard because my first few experiences were tough ones. And, so the more that I've done it, I've gotten a lot more performance animals. So I'm getting, I've got a couple of Rhodesian Ridgebacks that I'm working on, and they're coursing as well as conformation and such. So that's been a lot of fun. The two ladies that have the Ridgebacks will tell me, that she's just not moving forward right. I don't see that she's got a lot of good forward movement, or she's moving funny in the back end, or she's sidewinding. And so I work on them, and obviously it's going well because they have me work on them every show, before every show, and it's going well. I also worked on, chiropractic really deals with the spine, or any of the joints really, being out of alignment. Something called the subluxation, which is where the vertebrae just aren't quite in alignment. It's not, they call it sub. Sub is below, and a luxation is like a dislocation. So it's below a luxation. It's not quite, it's not a joint out of place in that manner, but it's more just not sitting right in the socket, joint. So what we do is we go back and we restore that motion to the spine. So the founder of chiropractic was D.D. Palmer. As those, so when you have that segment that's not moving well, the brain can't give the signals or receive signals properly, and you'll actually oftentimes get hyper signaling down that pathway. So if you think that, let's say, quiet, that the nerve, the vertebrae that goes to your lungs isn't moving properly. So you tend to get too much signaling. They talk about having like a garden hose effect, where you're getting a pinching of the nerve and then you get less flow. That happens sometimes, but much less often. A lot of times you get hyper signaling. So you're getting these aberrant signals to the organ, and you'll get something that we call dis-ease. It's just not at ease. The organ system isn't working as optimally as it should. So over a prolonged period of time, that can eventually lead to disease, because again, the brain and nervous system can't communicate with that organ. So by keeping your spine moving and allowing the nerve signals to go through unimpeded, you can help a lot of organ systems. So, for example, I worked on a lady years. Let's see. I wanted to explain a little bit about why chiropractic is important. It's not just, he's out of alignment, he's hurting. It's a lot more than that. So if you have a segment that's not moving, this primary area is not moving well, you get segments above and below that start moving too much. You get hypermobility. Because he's not doing his job, these have to pick up the slack and do the work for this joint. So over a prolonged period of time, the body doesn't like to have extra movement. Hypermobility isn't something the body likes. So over a period of time, it will start laying down extra bone to stabilize that. So you'll get arthritis and bone spurs kind of coming off status. It's coming off that vertebrae, and causing that arthritic change. So by keeping the spine moving well, you can head off a lot of the arthritic changes that can come just from misalignments. It's not necessarily going to help you if you have a really heavy traumatic injury and you get some big insult in there, then you probably will have some arthritic changes for sure. Even though that sounds very important to me, I don't by not being in ABCA. Going back to some of the things I said, the majority of the cases that I saw at the beginning were more life or death type situations. I'm seeing more animals with probably disc problems, pinched nerves, and behavioral changes, and then the performance. I think that dachshunds could pretty much keep me in business nonstop.
Wow.
They have so many problems. I don't know, and it doesn't even matter what age they are. Their bodies are so long, they really break down quickly.
Wow.
They get pinched nerves in their neck, they get low back problems.
May I ask a question? How do you do that without the dogs biting you?
I do use muzzles sometimes, and I try not to, because I want the dog to get used to me and accept it, great, in a good way. But the dog seems like they're not willing. I don't want to take a chance that the owner's going to get bit holding the animal or me.
Yeah.
I have gotten bit.
So you have the owner hold the dog. And
Yeah. The little dachshund that's on my website was the only one that's ever bit me.
oh.
So I was going to talk a little bit about some of the senior cases that I worked on. One was Katrina. She's a dog that I've been doing maintenance on. And I think she's 11. She's a golden retriever, sweetest dog. And her owner calls her Buddy. But her name's Katrina. She came to me with really foot drag. When they have the reflex where they can't flop their leg back over. She just was walking, really dragging both hind legs behind her, really weak and shaky, having a difficult time getting up, having trouble going for walks. She was still eating well, enjoying her time with her owner, but just getting very difficult. So I think I worked on her about twice, and every time it was less and less foot drag, and now we're seeing her once a month. I think I saw her twice a month for 1 or 2 months, and then now we're just on maintenance, and it seems like once a month really keeps her in really good shape. I've actually seen her try to jump in the car. She needs a little help still, but she can pretty much jump back in the car by herself. She's not dragging her legs anymore. She's happy, and she'll come right up when she sees me. She comes right up to me, and she knows that we're going to work on her, and she feels better when we're done.
What caused that?
Well, she's older.